Heart murmur is basically a noisy sound, like some people describe it as a whoosh, whoosh, hearing it within the heartbeats, which usually lap, 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 lap. So basically, when people listen to the chest of the baby or the child, they will hear lap, 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 and it's a murmur. Heart murmur is very common in neonate, and it's mainly really due to the fast heart rates of the baby. Like heart rate for the baby reach up to 100, 110. Heart rate for adult is around 50 to 70. So this is a difference. And because the heart rate is very fast, the blood goes very fast, you will hear some noise around it. The noise basically is not always abnormal. It can be normal, but we can't rule out any abnormality. And this is really the question that we always ask when people hear heart murmur, that we need to assess the child formally from the medical point. Right, always the question, is this heart murmur dangerous? Do I need to do anything for my child? The problem here is comes into two aspects. If there is parent concern about the child, that the child have symptoms like excessive tiredness, looks pale, looks sweating, get fainting, get syncope, get chest pain, all this kind of thing, indicating that we need to assess the heart murmur to make sure there is no pathology underlying it. On the other hand, if the parent have no concern at all about the child, in the mean that he looks very healthy, he's active. Now, the question when we listen to the child is really the intensity of the heart murmur, because we have heart murmur grades system. We call it grade 1 to grade 6. Grade 1 is very hard to hear the murmur. People sometimes hear it, sometimes don't hear it. Grade 2 and then above is more easy to hear. Of course, above grade 3 up to grade 6 is abnormal murmur, means there is definitive pathology. So this is how we assess is this murmur is what we call innocent murmur or benign murmur, hemic murmur, hemodynamically insignificant, or no, we need really to look deep in this child to make sure that we, instead of leaving it, we have to examine, we have to arrange an investigation in the form of ECG, in the form of 24-hour ECG to make sure there is no arrhythmia. Also, to arrange something called echocardiogram, which is a scan of the heart, which gives you the structure of the heart. And parents know the result on the same day, reassured, go home safely. And the most common cause of heart murmur in neonate is innocent murmur. So what we call 90%, 95% of murmurs in neonate will be nothing, will be, as I mentioned, due to fast heart rates, moving blood into different room of the heart, causing this kind of murmur. But this is, again, we'll go back to, is the baby and child have any symptom? If the intensity of murmur is high, we need really to assess the child. Innocent murmur in a child just go away by itself by 10 years because the heart rate will start to slow down, and in this way, just the murmur will disappear. Some people can last with heart murmur innocent up to 15 years, but most of the children people wouldn't be able to hear the murmur at 10 years. On the other hand, just if the murmur no persists or if the murmur is loud in intensity, this child need to be had a formal cardiac assessment. My role as pediatrician with a special interest in cardiology is to identify this patient, and then I'm working within network of cardiac center, which is St. Thomas, Evelina, and the Brompton Hospital, and basically once we identify problem, if it is simple problem, I keep follow up. If it is something need escalation, I share this as multidisciplinary with my colleague in order to get safety and formal assessment for the child. Two things the parents need to be aware of. They need to make sure they need to seek assessment immediately if the child is symptomatic. in the form of comment from school, comment from friends, parents, of course, if you, grandparent, extended family, that the child doesn't look right, doesn't look a bit pale, look working hard with breathing, excessive sweating, all this kind of issue, older child that getting fainting or syncope or chest pain, or even feeling palpitation or something like that. All this also is very important. Parents need to seek consultation for that. Or if they manage to go to their GP, and then the GP feel that, oh, I hear kind of disturbance or difference in the heart rhythm, what we call palpitation or arrhythmia, or sometimes they hear the murmur and they got, the GP is worried. If the GP is worried, I'll be worried, and the child need to be assessed. Right. For management of heart murmur is really depend on the cause. So if it is innocent, we don't need to do anything. Usually we discharge the patient immediately. We don't need even to repeat echo unless the child had any symptom. If we found any condition in the heart, and I mean kind of like hole between the rooms of the heart, or some leak in the valve, which is like doors in the heart, or tightness, we call it stenosis, or any abnormality, in that case, we need the aspect of management will go into two directions. Direction one, which is most common, 95%, is basically regular screening to make sure that the heart maintain function and is stable and not causing any problem. And this is typically we see sometimes with patients with like hypermobility or rheumatoid patient having rheumatoid factor positive or having any kind of like excessive hypermobility as well, or any underlying rheumatological condition. We keep screening them every year. On the other hand, if there is any abnormality detected, like a big hole in the heart, it depends on where is the hole exactly. And in that case, as I mentioned, I work within network, cardiac network. I got all kinds of support from different places in central London in order to facilitate more active management. If the child needs surgery, we had this. Also, if the child needs what we call device closure, because most of this condition will be managed most likely without any open heart surgery. It's a day case where they put just a keyhole through the arm or the legs and just pass a long catheter in order to put a simple device to close the defect in the heart and make the child more healthy and asymptomatic. So in summary, it will be all in control.